I have sometimes a problem telling people what's the difference. I'm actually writing an article right now called "This is not functional medicine, so what is innovative medicine?" In your experience, from the medical standpoint, clinical standpoint, can you differentiate the two a little bit for the people listening?
Yeah, I mean, functional medicine as it exists right now in America and the world is very data driven. It's very lab driven. Um, you know, it's maybe unconventional in that you're using labs that aren't traditional, and you're not you're looking at labs that aren't necessarily obviously covered by insurance. But there's also looking at even looking at traditional labs in a kind of a different way and looking at it more of a functional. So the idea is that, let's say you get a CBC back, or a standard hormonal panel back. Let's take TSH for example, which is the thyroid stimulating hormone, basically like the master hormone for the thyroid. There's a range which is considered normal for most doctors. Most conventional endocrinologists say, okay, if the TSH is anywhere between 0 and 4, you're fine, you're good. That's kind of the conventional wisdom, the conventional range. Where the functional medicine range says, okay, wait a second, you're having symptoms of hypothyroid, of not enough thyroid. You're losing your hair. You've got dry skin. You've got constipation. You're fatigued. All these are huge signs of hypothyroidism. And when we look at your labs, they're not outside of that conventional range. They're not above 4. They're not getting super high, but they're high enough to where we can say, okay, this is out of a functional range. And Dr. McDougall is actually, brilliant at this, and she's come up with a range where you stick around 1. Basically, anything above 1.5 is considered a very tight range, and if the TSH goes above that, it's considered functionally hypothyroid. So you're not traditionally hypothyroid, but you're functionally hypothyroid. And in those cases, she says, okay, let's give you like a really low dose thyroid. Let's give you like a super low dose thyroid and see how you feel. And the patients start feeling better. They start feeling amazing. And so that's kind of a functional approach to thyroid. And you can do the same thing with all the labs and basically all the hormones. And it's looking at labs in a different way. But like you said, it is still conventional labs. It's conventional testing. It's conventional blood work. That's functional medicine in a nutshell. Your dad's approach, innovative medicine approach, bioanalysis, resonance of health, is looking at the body in a much kind of bigger way, kind of step back kind of globally, and let's step back even further. Let's see what's going on here, and taking into account energetics, looking at bioenergetics, looking at resonance, looking at how the body responds, looking at these more traditional modalities of Chinese medicine, Ayurveda, that have understood the value of energy and how energy predates form, and how acupuncture and how all the meridian system in the body actually predates any actual physical manifestation in the body. So looking at those higher level, basically higher level systems to then affect, and making subtle adjustments there in those higher levels to then have huge downstream effects on the body, and kind of to reestablish self-regulation. The idea is, even within functional medicine, the idea then becomes, okay, we gave you this little bit of thyroid, you felt better, but now we're managing your thyroid for the rest of your life. Basically, we're going to be adjusting it, altering it, and we're never really restoring your body's ability to heal its thyroid and produce normal thyroid on its own. And so looking at even deeper, looking at these underlying factors, looking at energy, looking at energetics, looking at underlying causes, heavy metals, and looking at toxicity, looking at diet, looking at all these really, and not to say that functional medicine doesn't do these things, but kind of looking at these things more globally from a larger kind of bird's eye view, and then making subtle changes to where the body can then reestablish self-regulation on its own. That's kind of the biggest way I've seen how I would describe maybe the difference between the two approaches. And another approach, another way I would kind of describe the approach is that your father has tremendous success. basically every single patient that walks in the door is going to be better. Whereas in the functional medicine approach, 80% of the people get
Yep.
better, and then you get the kind of the outliers, which are harder to read, harder to treat, and don't really respond. Those patients that you've tried all these things and nothing's really working, you keep circling back, you keep trying new things, and so and again, even in the functional medicine approach, a lot of the docs aren't really getting at underlying causes. They're just trying to manage kind of symptoms in a more holistic way, in a less invasive way, but still it's management versus reestablishing self-regulation.